Okay, so we've got first quarterly webinar of 2025 today. And then we are going to talk about our most asked question, um, which you can probably guess is, do we take insurance? So we're going to talk through some of the nuances and how we handle that and how we can handle it better, and all of the questions that come along with that. So can you all see this screen okay?
Yes.
Awesome. Great. All right. Okay, so first thing, I had a call yesterday. I have knee pain. Okay, tell me more about it. Do you take insurance? And like, it's the first question, right? The very first question. So how do you answer that? How do you answer that, Mike? I'm just curious.
Uh, the answer is no. Not in, after that becomes some awkward conversation. Yes.
And that's where we
So,
want, that's good because that's what I want, that's what I want to talk about. It's exactly what we need to talk about for sure. Yeah, so no, sorry. We a lot of times say that, just no, which well, we'll get in more into it. And then sometimes we can say, oh, well, you can file for reimbursement, but then their brains kind of like start spiraling, right? Like, what is this? Me filing, what's reimbursement, what's out of network? A good answer though, really good answer though, is we do take HSA and FSA cards, but we still
mhm.
didn't like answer their question, right? And we didn't address really or ask them even more of what's going on. So the whole point of me wanting to talk through this subject is so that when you do have those phone calls, you can continue. You're not shutting it down, right? Like you're continuing, you're earning that conversation. You're going to continue to learn more about them. So, how do you answer it right now, Shania? Or I should say, before you started working on your answer, because we've worked on it, what
Yeah.
would you have said? Maybe like when you first started with us, what would you
Yeah, I that HSA and FSA is golden. And I still use it like if as like after a follow-up question, but like I've used that since day one just because like a lot of people have those and I think I don't know, we just learned about a lot about it in school and how people don't use them. So I feel like ever since I started, I've just always said that. Like no, we don't take insurance, but we take HSA and FSA cards. Like it's just like right out of the tongue.
Mhm.
So
Yeah, yeah, absolutely. And that's something a lot of people have these days. But what I want to encourage you to do is to really think outside of the box. Like continue, like I said, continue that conversation. People like to talk about themselves, you know? So and they're calling for a reason. So tell me more about what you're looking for. You know, so the patient that called today, do you take insurance or yesterday, do you take insurance? I want knee pain for my or treatment for my knee. So I would say, oh, well, tell me more about your knee pain. What is that like? When did that start? Have you ever had physical therapy before? Because we just don't know the lens through which they're seeing all of this. We don't know their past experience, and we don't want to put what we think or know or assuming onto their questions, right? Like, yes, they are wanting a direct answer. So for sure we'll get to that. But sometimes to have more of that conversation from the front end. So yeah, what was that physical therapy experience before? Because it could have been they had a great one-on-one experience, maybe someone who came to their house. It could have been they were at an overcrowded outpatient clinic and they felt very looked over. They felt like it was a waste of their time. It might be that, oh, my doctor's just telling me to do this. So you want to know a little bit more about what was that experience that they had. So we're gonna do a little bit of pretending. Like I said, Mike, you can keep that microphone on. And so let's pretend you do have a patient that's calling. So you're answering, and then how would you continue that conversation? So if I was calling you, Shania, and I would say, "Hey, I'm looking for a physical therapist for neck pain. Do you take my insurance? I have UHC. Where would you go with that?" Oh, for Shania. Did you hear me? Can you
Okay.
hear
sorry, I thought this through mine.
me? For Shania.
No. No, where did I go with that? So, I would say for do I take UHC? That was your direct question. So I
Yeah,
would
I
be
said
like,
I'm looking for a PT with that for my neck pain. Do you take my insurance? I have UHC.
sure. What specific experience do you have with physical therapy? And if you've had any, what specifically went well for you and what didn't go so well?
Yeah. So you asked three questions, right? We
Mhm.
could just take it down to one, right? What was the first part? Yeah.
So I think what specifically are you looking for in terms of
Yeah.
physical therapy treatment?
Well, I've been reading about dry needling. And so
Okay,
I'm
awesome.
interested. Can that help my neck pain?
Well, there's a lot of good research that says the dry needling can help with neck pain. I personally don't specialize in dry needling, so I could do treatments like cupping and soft tissue work, but we do have other therapists that I could refer you out to that live nearby. Most definitely that could help you with that. But what specifically drew you into dry needling?
Yeah, I love that. Like keep getting them, right? Like keep directing that into like for them to talk about them, right? You want to know like why did you it could have been they don't know anything about dry needling. They just saw their like they heard their neighbor had it, right? So like it doesn't matter that you don't do it because you're gonna sell them on cupping or manual therapy or exercise, right? Like just your skill set, you're gonna sell them on that. So yeah, so my neighbor said that she did it and it worked really well.
Awesome. Well, yeah. So research shows that after, one session of dry needling equates to like 5 sessions of manual therapy. So that's awesome. However, there are several other, things we can focus on. Have you ever thought about, exercise in terms of helping your pain?
No, I just
Are
wanted
you
to
currently
do something.
exercising?
No, not at all.
Okay. So that's definitely something that you can work on through physical therapy. So I'm glad that you don't have a ton of experience with it because we can definitely help you with that. Um, yeah, overall, I think you would be a solid candidate for concierge orthopedics.
Awesome.
Now, you had asked about UHC specifically. We have all the treatments that you're kind of looking for in terms of, we do offer dry needling. I don't directly do it. However, there's other services that could be super beneficial for your pain. But in terms of UHC, we accept HSA and FSA plans. So if you have one of those through UHC, do you currently?
Yeah, I have an HSA card.
Okay, perfect. You can use that for your first visit and that'll be covered. So that is great.
Perfect. Because you like totally steered me from like I thought I needed dry needling and I thought I had to use my insurance, right? But you just don't know unless you are asking those questions. And finding out their biggest pain point in sales, this is a big thing, right? Like when we did all our sales training, there was always like, what's their pain point? What's like gonna get them? Because that's what's gonna spur them, what's gonna cause them to act. But it's a little bit easier for us, I feel like, because like they literally have a pain point. So like we
Mhm.
literally can be like, oh, knee pain or neck pain or whatever. But it's also great to know what it's keeping them from doing because when you can cast it in that light, yeah. So today, the lady who called yesterday about knee pain, and I evaled her today, and she specifically said, yeah, I have my three grandkids coming in. I love to garden, but I can't get up and down off the ground anymore. So that was everything was framed around, well, you can do this and this. It'll take about this long until you can start gardening again. Doesn't that sound great? You want to sell them on what their goal is, not assume what mine is for them, that which would be full range of motion or full strength or something that's like so what to them, right? But
Yeah.
let's go back more to just asking some of those questions. So, whoops, here we go. Yeah, so asking about their previous PT experience. Let's not assume just because they're new to you that they had a bad one. Even though we hear a lot of that, right? It also would be great if they did have a good one because, like, what did you like about it? Did you like your hands-on time? Did you like your exercise time? Did you like that you were given a home exercise program to work on your own? Those are all things that we want answers to. If it wasn't good, why not? Was it because it was overcrowded or you had a hard time getting there? Like, what were those barriers getting you to have a great PT experience? And then also, I like to know, like, what else have they already tried? Um, so, are they like a regular at a gym or chiropractic or, what does their rehab journey look like? Have they already been to an orthopedic, or are we getting them through direct access? And then I love to know, like, what caused you to reach out to us? Did you find us on an ad? Did a friend tell you? Was it something specifically you read on our website? Because I want to be able to speak right to that, right? Or if like we did previously, Shania, how it was, well, yeah, specifically was reaching out for dry needling, but that's not something you offer. So how can you supplement that? And you casted the vision of me getting better, and that like completely overrode. It wasn't the dry needling that was my frame of mind. It was the getting better. And I just thought it needed the dry needling. But as long as you can continue to like frame that thought of them, with whatever their personal win is, for me to reduce that neck pain and for you to be the one to do it, doesn't necessarily have to be the dry needling, right? Um, and so then, yeah, what would a successful PT outcome look like to you? Not everybody wants to get out there and run a marathon or be able to get back to lifting weights. Some of them just want to be able to garden and walk around SeaWorld with their grandkids. So that's what we want to know, what level of activity they're trying to get back to, because that changes their answer to their question, right? Because if they're asking for insurance, they probably have some cost concerns. And so that's also, can be reflected on what kind of level of activity they're trying to get back to, because that would change the length of their visit, right? Or the length of their treatment course, right? And then biggest obstacles, 'cause sometimes people are reaching out because maybe they don't have time, like maybe the traditional 7 to 7 outpatient clinic hours, Monday through Friday, are not going to work for them. Or maybe they're interested, they want to know, like, can you do a weekend or do some telehealth? Or I could never do it because I can't get to it. Can someone come to me? So those are all questions that are good to know the answer to. And why are you not reaching your goal currently? So like what with this lady in particular, I wanted to know, even on the phone before we booked the appointment, I was like, oh, what kind of things are you having trouble with? And she said, I just can't walk around my office anymore. I'm having so much pain. Oh, why not? Oh, well, it's because my knee feels like it's going to give out, so I want to know specifically what's stopping her from those goals. And so remember, oh, that got off the line.
Mute.
Value does not always equal the cost, right? Like we can pay a lot of money for something and it not be that great, just because the value is not there. The value is equal to the worth. So when you cast that vision of what is this worth to them, if this is worth their independence, if this is worth them having a great visit with their grandkids, then that value is there. And so then the cost, I mean, yes, within reason, you have got to discuss cost, but it definitely changes the conversation when they really see the worth, like your worth in your services, right? And it's not, I got this from a sales training. It's do not place your values on them. And don't assume, no, I'm sorry, I got it from the highly is it 7 habits of highly effective people or 10? I can't remember how many habits there are. But he talks,
Seven, yeah.
seven is a seven, yeah.
Mhm.
And he talks about don't place your values on them. Don't assume that you know what's important um, because of what you value. Like don't place your autobiography in the person in any conversation, but especially in this, because like this lady, it's not really important for her to get on a regular exercise routine to be able to jog a mile. Like if that was important to me, what's important to her is she wants to walk around SeaWorld. Like she wants to garden and get up and down. So I need to know what her goals are specifically, not what I think is valuable for her to do, you know? And then how you want to like be so honed in on this. Oh, we got a little sad guy. Ignore the sad guy. This is happy.
I
You're
was
how can
wondering
working
why he
with
was sad.
I don't know why he's sad. How can working with you allow them to meet their goal? And that's like you just want to be so focused on and such a cheerleader for them. Like I want to be able to get you to reach this goal. Like this is my main mission. And they'll see that in you, right? They'll feel that. Because if it and that's the value of being concierge care, right? Is um we don't have to see a ton of patients and we can be cheerleaders and be like solely focused on one patient and know exactly what they're needing and be able to cheer them on along the way. And so a great thing to do just to make them feel, like, and also to help you remember what they're saying is to do a little bit of mirroring, a little bit of listing back what they said. So, saying things like, it sounds like this is what's going on, Claudia, always saying their name. But was there any other information you would like to share? Does that sound good to you, Claudia? So getting those micro yeses, and I'll talk a little bit more about those. So always saying their name, making sure you're getting their name in that conversation and pulling out like what they told you. So they really get like, this lady, yes, she also mentioned some ankle pain. But what her big priority was this knee pain. This knee pain is keeping her from gardening, and that was her hobby. She's retired. That's what she wants to do. So, you don't want to be in a situation where you're like focusing on, oh, this ankle pain that's really not that important to her, right? You want to like be able to pull out like, this is what's important to her. I want her to understand that I know I'm listening to her about that. And getting those micro yeses. Like, does that sound right? Did I understand you correctly? All of those kind of things is just getting them to agree, kind of nod along with you. And that's what you want, right? You want to get back to your grandkids. You want to get back to walking around SeaWorld and getting all of those yeses. And that's a great one, whether you're in the eval selling them on this cash-based service or on the phone call, right? Because if you're on the phone call and they're telling you, do you have insurance? But then I'm already talking about asking them questions. Oh, tell me more what's going on. Oh, you can't do this. Okay. Oh, well, did you know you could do XYZ and get back to gardening? And that's what you want, right? Doesn't that sound good to you? And then she's just nodding along. And so the next step is to be like, yes, yes, sign me up for that one, rather than hitting a lot of no's. And then I like to also just mirror them to say, am I hearing you correctly? Like, does that sound like what you were talking about, what you were asking for? And then is there anything else that you would like to mention, you would like to bring up as well? So this is the big thing I have been working on, and we don't say I, is taking
Too.
out the I, we, or me. And it has really changed a lot of that conversation because it doesn't matter what I know or what, me, what I think. It's them. Like I want to put it back on them, put the power in their hands, and they want to talk about themselves, right? And we want to hear about them. So you sound like a lot like a patient that came in with knee pain rather than I've treated this before and I've seen them do great and they worked with me and it was wonderful. That's one way to say this. Another way to say it is you sound a lot like a patient that came in with knee pain and they got back to running after 3 sessions. Doesn't that sound good to you? Rather than look at what I did. Like don't put the attention on you. You want to put it back on them. And then establishing those expectations for them as well. Kind of like what you said, Shania, you'd be a great fit for concierge orthopedics. And this is where I would say, I would love to tell you about more about what your session would be like. Would that be okay with you? And then explaining to them. And this is where that information of what was your PT experience before is really important because you want to let them know all these sessions will be one-on-one. You'll have the same physical therapist every time. We have treatment once a week. We've seen that works, that gets faster results. But then you'll also have a toolkit that you can do some things on your own at home. And then I always love to, and you kind of talked about this, Shania, I think in your last visit was picking the one thing, like just picking one thing that will get better at the end of the visit. Because will we cure them all in one visit? No. But can we alter something? Very likely. Even if it's just the education, right? Even if we just said at the end of the visit, you will understand more of the pathology of your problem. I mean, even that is a win. Even if you can't alter symptoms, right? Is the knowledge as a gift to them. And then does that sound good to you? And at this point, yes, it takes more time. It takes more time on the phone. It takes a little more time in the eval, but you're getting that buy-in. You're getting that nodding. You're getting their story. You're really framing everything that you're trying to show them within what their highest goal is, and that's where you want to get that patient. And so, yes. So, and then, we don't want to go completely skirt around the issue. Like they specifically asked you a question. They want to know if you take insurance. I'm not telling you to like not answer, but have some finesse with it, maybe would be a good word, some persuasion. And so I will say, so glad you asked, Claudia. Most of our patients have insurance, and I would love to tell you about how you can get them involved. Um, that is a longer, like detailed, heavy conversation. So sometimes them just knowing that like they can get involved is good enough for them because they've paid these premiums, they want to use them. I get it. I mean, we all have insurance, right? And so you want to be able to use it, but it can be a bit overwhelming for patients. And also just focusing on what differentiates like how we do things, like with that one-on-one care, that once a week care versus, multiple visits with maybe only seeing your provider 15 minutes one-on-one, the differences between those. And then I always tell them, and you can use a super bill and submit. And sometimes reimbursements are 50 to 80% after the deductible. And you'll know by the time in the conversation if this patient is appropriate to give them that information because you don't want to give them so much that they're overwhelmed and get decision fatigue. You want to listen, but the only way you know how much they can handle is by asking those questions. And they're going to tell you. They're going to tell you what they're looking for, and they're going to let you know what they can handle at that time by the questions and the answers that they have. And so, just by having a conversation rather than just a no, that's how you get there, right? You want to reframe this and so just by acknowledging, yes, your knee pain can be reduced, where you'll have exercises to strengthen your knee to manage your pain after your first visit. And then does that sound good to you? And I always will give them like two options to be able to choose their appointments because that's another thing. That's another decision fatigue, right? If they absolutely cannot meet any of those, of course, I'll open up more, but I'll look at my schedule and say, I can do Friday at 10 or Monday at 8, which one works better for you? And that's going to just streamline their decision as well. But yes, so let's see. In conclusion, you cannot sell if you're not sold. And so this is from Alex Hermosi. Oh, I think it's an E, but
Oh, it's
people
a
will,
no. It's right.
huh? Do
It's
what?
correct. It's correct.
Oh,
You're good.
I had an E and you probably fixed it. Sales is a transfer of belief over a bridge of trust. So we are trying, they're starting out on one side of the bridge at that phone call, and we're trying to get them over to the other. And we don't want to be all the way over here on the bridge and look back and they're over here because we haven't sold them, because we haven't asked any questions, because we don't even know what's important to them, right? Let me move this a little bit. And so if we are solely focused on like what their payoff is, like I so want this woman to be able to garden. I want her to have a great week with her grandkids this weekend. And they will, that radiates off of you, right? That is reflected in everything that, like every question that you answer and ask of them, every treatment, every exercise, like they know that. They know if you're on their side or if they're just a number. And we don't have patients that are just numbers here. And that's the great thing about what we do. And so I know I can help this patient work all day in her store. I can help this patient win the district track meet. I can help this patient with her club volleyball team. I can help this patient garden. And so you want to be focused on that end result and then cast that vision for them so that they understand, like, oh, I'm not just finding a physical therapist. I'm getting back this part of my life that I'm missing out on right now. And then it completely negates the price, right? Like, that is so much more than do you take insurance because you're like offering them an experience and you're giving them back something that they've lost. It's very important to them. And so we take it out. I've even tried to not even say anything. I used to always kind of try to find something in common with the patient and then like really hone in on that. And it's like, what if I just ask them questions? Like the whole time I'm working on, I'm like, I'm not even going to tell you anything about me. I just want to ask them questions. And it really has changed the tone of my visits. Like I've been trying really hard on that the last like month or so. And not that I don't share information in life with them, because a lot of them, we live in this small town together. But it's very different because you see what lights them up. Like you see where you want to frame that vision. Like with this lady, she never said anything about grandkids until I pulled it out of her. And you could tell like she just wants to be able to keep up with her 5-year-old granddaughter that's on the airplane today. And so when I could switch to that and like, hey, and when your granddaughter y'all standing at the counter, I just want you to step backwards. Have her do it with you. She can count for you. When you just change how that looks, how that that feels to her because that's something they can do together. And it's not always like that. But that was her win. And so that's where I wanted to frame that conversation for her. Um, so this webinar is a lot more than just do you take insurance because that there's a lot more to that question, you know? It's not a yes or no. And that would be my biggest takeaway I would want people to get from this is that that question's not yes or no because there's so much behind that question. There's so many expectations from the patient. There's so much pain and pathology. Like there's a reason they're reaching out, and if we would just take the time to like get the answer to that, and then, like you said, Shania, hey, I don't do this, but I could find somebody that could, even if they are, after all of that, we've listened to everything they had to say. I know their grandkids' name, their dog's name, their activities next weekend, and they still want to use that insurance, then I'm going to say, I'm going to find the very best fit for you. And I'm going to give you their name and number. And if something happens, you're going to call me back if you need anything else. And what's going to happen is when they go, if maybe they'll love it. And like, that's so great. That's wonderful. There's a guy here in town I send people to, and I'll tell them, I'm like, if they just insist on seeing insurance, I'm going to send them to you. And I expect you to give them a good experience now. And he's very grateful. And then he knows too, like if there's someone that doesn't fit his clinic, he's going to send them to me. But that patient is always going to remember how you made them feel like you were not they were not just calling an insurance company to ask a question, right? They were listened to, they asked questions about themselves, and they're going to remember that. So that would be my biggest takeaway that I would want people to gain from this webinar. So here are some references that are really good if y'all want to grab any of these at any time. But yeah, do y'all have any questions? How have you shifted a little bit? Shania, you said at first that you would just jump right to HSA cards. So have you shifted that conversation as of late?
Yeah, I think there's been a lot of unique situations lately. I know you and I had a conversation at the beginning of this talk, but I've had a lot of patients either be in tandem recently, where they're like going to a normal insurance and like are fed up, or they have had PT in the past where they're coming and they don't have a ton of pushback. But I've had the exact polar opposite too, where they don't think like, oh, I shouldn't, go to cash pay because I could try to get reimbursed from my insurance. And then I'm like you, where I'm like, oh, sure, UW Health is super reputable. Like, I totally understand. Like, you get through all the things and you just
Mhm.
gotta. I feel like we're so used to explaining, like, I can help you better. Like, I can do it better. And I'm just like to the point where that's totally okay. You explain yourself and you don't want to explain it away as I, because at the end of the day, what resonated with me, what you just said, that care that we provide is totally different from the clinic. So what usually happens is they'll go, and maybe you see this with your guy too, you referred to, and then they're like, hey, like this didn't work. Can you see me for an
Yeah.
eval? And you're like, yeah, like I still want to see you, So
Yeah.
but I think the biggest thing that I've learned since our sales training is just owning up to not knowing sometimes and being okay with it versus trying to explain yourself away because you feel like, you are either more valuable in terms of the help, or you think you could provide better service. It's like once you ask those questions and you build the rapport, that's going to sell itself. You don't need to explain yourself away to elicit buy-in. It's like if they're being heard, they're not just a number and they didn't have to jump through 7 hoops before they see you. They're already feeling like, they're receiving premier care. So I think the biggest thing that I've learned is just not explaining away your value as a clinician, but instead asking them what they, really want to get out of it and then selling yourself indirectly.
Yeah. And not to be apologetic. Like I still
Yeah.
have the tendency when someone says, oh, do you take insurance? No, sorry. And it's like, you did that for a reason. And so we should be confident in it, right? Like, no,
Right.
like there's so much more to that answer. And then also not to be defensive about it.
Hmm.
Well,
I think too.
I've seen it's like, no, well, tell me more about that. How do you feel about it? What are you looking for? And then when you can show that you've heard them and can deliver the care quickly, efficiently, and then how does that sound? They're like, yes, yes, yes. They're bought in.
I think too, like when you say like, no, I'm sorry, I don't take insurance, that's like saying, no, sorry, no, my services are expensive. And then it's like,
Mm.
uh, like we learn that too, like we're not expensive, like we're well worth the value that we provide and then some. So
Yeah.
it's like, I think with that point too, Kelly, it's like indirectly we're kind of saying like, yeah, we agree with you, we are expensive, sorry. So it's like there's no apology necessary. It's just like a reframe.
Yeah, yeah. Redirect.
Yep,
Redirect. Yeah.
I agree.
Have you had many of these conversations, Mike?
Um, not in this particular manner, but indirectly, yes. And moving the way I was moving, uh, I never really kind of I do definitely agree with everything you guys are saying, but I definitely didn't move in that direction, especially the HSA and the FHA. Although they're listed on my website for, types of payment that we take. So I've been uh more direct on yes or no, not trying to waste people's time, and I continue to go, but I can see how that comes across kind of listening to the way this conversation is going.
Yeah, and I think it's not all like there are you have to judge each situation, right? Like sometimes it's
Hmm.
gonna very like rush you. Like, no, really, I just want to know. And it's like, okay,
Hmm.
sometimes I've just got to tell you. But other times I would love to, have a conversation with you about that. And you can tell by the tone of their voice. That's the nice thing about like getting them on the phone rather than talking to them. And even like when if someone's to send an email to me and say, do you take insurance? I'll say, I would love to have a phone call with you. Can we talk about it? Can we talk about what you're looking for? Tell me what you're looking for. And then same thing, like if I can't help you, can I send you to somebody better fit? Because when it's all said and done, that helps our profession, right? What doesn't help our profession is for them to go to somebody that's triple booked and they're going to be frustrated and say PT doesn't work because I was just handed off to a tech and did a few things and it wasn't any good. So that's what we want to avoid, whether that's through us or through somebody else. Um, and so it takes some skill for sure, but this is something that at every single onboard we have this conversation with
That's
every single
great.
one of
I
them.
think I think one other thing too that I just thought about is I've gotten a lot of email referrals, right? And I've shifted frame of reference for those. It's not something we talked about today, but I think it would be valuable. Is like instead of like, hey, can I have your service menu? I want to learn more about PT. I set up that 15-minute phone screen with them, and
Yeah,
that gets them more buy-in than me sending the service menu. Like service menus, like a fluff at that point because they're already bought in, they're booked for an eval before I get off the phone, and then we send the service menu after. So like I think with what you said too, Kelly, like tone is everything. Like you email them, you send them the service menu, they're like, ooh, 175 for a eval.
yeah,
No,
they're
I
only
don't
looking at a number because they don't know the value
know.
because they haven't had the
Exactly.
conversation.
So I don't even send that anymore. And I got burned a few times doing that, to be honest. I lost a couple people because they weren't sold. But then after doing all this and kind of, spending more time on the questioning and learning more about their story, like
Yeah.
that sells itself.
So do you do a Zoom call or do you do a just a phone call?
It depends. If it's like on a weekend and it's quick, like back and forth, and they're like, I can call now, I'll just do a quick call. If they
Yeah.
want to do, some people don't like sharing their video. I've gotten a lot of pushback on that, even with some of my follow-up personal training clients, even they don't like to share their video, they just like to talk on the phone. So
Yeah.
I read the room on that. I mean, if they're open to video, I would prefer that just because you can really gather a lot. But if they're like busy and it's a weekend, they're with their kids, and I'll just say, we can just hop on a quick phone call. You can tell me a little bit more about your injury.
Yeah.
What do you do?
Um, most of mine are in person when I have those questions. Like it's more like in town. Like, do you take insurance? And for the longest time, I would just be like, no, or I take HSA, or I'm out of network. And I've just recently started asking more of the questions before I answer it. And you can just tell like everything shifts when you start asking them about themselves, like their whole body language kind of shifts where it's just like, oh, you're PT. Yeah. Do you take insurance? Do you do this, do this? And I'll say, oh, tell me more. What are you looking for? Oh, what do you do? When did that start? How'd you deal with that? And they just all of a sudden go from this like, oh, I was only going to talk to this lady if she took Blue Cross Blue Shield of Texas to like, yeah, and then this happened and it kept me from doing this. And so it's just a very different experience, a completely different. It's a conversation and not a transaction, because that's very transactional. Do you do this? Do you take this?
Yeah.
You know? Yeah.
I love that.
Yeah.
Well, this is great. Thank you so much, Kelly.
Oh, y'all are so on. Thanks for hopping on, Mike. It was so good to see you. I'm gonna stop the recording now.